Hi, my name is Dr. Amanda Isac, and I'm a pharmacist with the North Carolina Division of Public Health. Today, we'll be talking about the role pharmacists can play in responding to the opioid crisis by increasing access to naloxone. As you may know, naloxone is an opioid antagonist that is administered both by laypersons and health professionals in emergency situations to reverse the effects of an opioid overdose. As of June 2016, pharmacists licensed by the North Carolina Board of Pharmacy may dispense naloxone without having a patient-specific prescription under the statewide standing order, which is signed by the North Carolina State Health Director. You can locate a copy of this standing order on either the North Carolina Board of Pharmacy website or naloxonesaves.org. You may be wondering who is eligible for naloxone. The statewide standing order outlines a number of eligibility criteria for receiving naloxone, including those with risk factors such as concurrent use of opioids and benzodiazepines, those on high doses of opioids, those with a history of substance use disorder, among others. The intention of this standing order is to be as broad as possible, so that anyone who may be at risk of an overdose or may be in a situation to help someone at risk of an overdose can request naloxone. This may include a concerned family member, a teacher, or even a law enforcement agent. Please note, you do not have to wait for someone to request naloxone to dispense it. We would encourage you to build in a workflow process in your pharmacy for screening individuals utilizing the Controlled Substances Reporting System, or CSRS, and other screening tools to proactively offer naloxone. You may view the other videos in this series to learn more about validated screening tools. Next, you may be thinking, what steps do I need to take before using the statewide standing order? There are no specific steps you need to take prior to using the statewide standing order. However, the North Carolina Division of Public Health does encourage you to register your pharmacy's participation through a form on the naloxonesaves.org website. While this is not required, information submitted is used to develop a statewide map of all pharmacy locations in North Carolina where an individual can access naloxone. Recognize that registering with this website denotes your pharmacy is willing to stock and dispense naloxone under standing order. So, how do I process a prescription under the statewide standing order? Process a prescription for naloxone under the standing order the same you would any other prescription. The primary difference is that the prescriber will be the state health director, whose name and MPI number are listed on the standing order. If available, you may process insurance when using this standing order. In situations when an individual may not be the end recipient of naloxone, but believe they could be in a situation to assist, you may process the naloxone prescription under the assister's name and insurance. From here, you may be considering, what type of naloxone should I dispense? Naloxone is available in several different formulations, including both intranasal and intramuscular forms. Naloxone products eligible to be dispensed under the statewide standing order are listed here. Product selection will depend on different factors, including patient preference and insurance coverage. Now that you know about naloxone, you may be curious about how to initiate a conversation about it in a way that reduces stigma, yet conveys the importance of carrying naloxone. One of the ways found to be most helpful is in normalizing the conversation. Try comparing naloxone to a fire extinguisher or an EpiPen, something we hope you will never need, but have just in case you or someone else is ever in an emergency situation. It is also an important item to have if you have children in the house who may be accidentally exposed to an opioid. Avoid using charged words such as overdose, and instead consider using a term such as breathing emergency. The American Pharmacists Association, or APHA, has a valuable guide on how to talk to patients and family members about naloxone, taking into consideration patient-specific characteristics. We'd encourage you to utilize this resource, which is available both on the APHA website and naloxonesaves.org. This brings up the question of, how do I counsel an individual on naloxone? When counseling an individual on naloxone, it is important to talk about risk factors of an overdose, signs of an overdose, and the steps to responding to an overdose, including calling 911, administering naloxone, and performing rescue breathing if that person is trained. Convey to patients the importance of teaching their family members and friends how to use naloxone and letting them know where it is kept. Provide take-home resources to reinforce education and training. Some helpful patient education resources you can utilize are available on naloxonesaves.org. Many people may wonder if naloxone encourages continued drug use. The idea that naloxone encourages drug use or prevents individuals from seeking treatment is one of the most common myths that surround the use of naloxone. Research has shown this is simply not true. In fact, the experience of an overdose often serves as a catalyst to encourage individuals to seek treatment. Lastly, where else can I refer individuals for naloxone? In some situations, individuals may be candidates for naloxone, but may choose not to obtain it due to lack of insurance coverage, high copay, or other reason. We would encourage all pharmacists to know your local resources. Syringe service programs and many local health departments in North Carolina offer naloxone at no or low cost. To find a syringe service program or health department near you that offers naloxone, visit naloxonesaves.org. I hope you have found this video helpful. As pharmacists on the front line, dispensing this life-saving medication is a critical, evidence-based step to keeping individuals in your community safe and helping us turn the tide on this crisis. Thank you.